it's Hina Sheth here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And I want to talk to all of you who are experiencing pain in the genital area or in and around the perineum, the rectal area, and you are freaking out because you are thinking that this could have come from an STD, and now you are not sure what to do because you either think that this pain is coming from an STD and you haven't gotten it examined yet, or you've gone to, if you're a male, gone to a urologist. If you're a female, maybe gone to a gynecologist, and you've had testing done and nothing's coming back positive. It's insignificant. Your doctors have no idea why you're having this pain because it's not coming from an STD. Or perhaps you had an STD and you had it treated, but you're still having pain down there, and now everyone's confused and they have no idea what's going on. Now, I'm here to tell you the likelihood that what I'm going to tell you is going on is pretty high. And I'm going to tell you what you can do about it afterwards. So let me just tell you a little bit about myself so you understand why is it that I'm talking about this. So I am a physical therapist that specializes in something called pelvic floor dysfunction. Now, the pelvic floor is a group of muscles that sit inside your pelvis. So if we look at this model of the pelvis and we look inside, there's this red stuff right in through here. This is all a model of muscle that's inside the pelvis that you cannot see. And if you look from the underside, okay, this is where you sit when you are sitting in a chair. This is the saddle area that if you were sitting on a bike or a horse, this is the area that would be touching. This is the perineal area. This is the musculature that part of what we do at our clinic. We partly specialize in treatment of complex issues of these muscles. And when these muscles become problematic, they can cause all sorts of havoc that can just make you spin in circles, and many people don't understand what's going on. And when I say people, not only you guys out there, but the own medical profession, physicians, nurse practitioners, primary care physicians, gynecologists, urologists, many of them do not understand that sometimes the pain that you are experiencing right now, okay, all this perineal pain, maybe it's rectal pain, vaginal pain for women, testicular, scrotal, penile pain for men, okay, and I'm sure a whole of a host more. Maybe you're having bladder symptoms as well. Maybe you're having GI issues. Maybe you're having colorectal issues. All of these things can actually tie into these muscles becoming a problem. And so when you start developing pain there, most people's natural inclination is to say, oh my gosh, do I have an infection? Do I have an STD? Do I have something going on that is causing this pain? And when nothing is coming out positive, the likelihood that these muscles are the problem is very, very high. And how do I know this? Because I specialize in this, because we've been working on patients that have these issues. Somewhere now, I would say close to 20, something years. And so we see this every single day, and we hear the same story in multiple ways every single day. And so what I'm here to tell you is these muscles might be the problem, and your physicians may not have any idea that this is the reason why. Because when these muscles become tight, they can actually cause referred pain into any and all of these areas inside the perineum, as well as affecting the bowel, the bladder, and sexual functioning. So for men, you might be having potentially pain with ejaculation, post-intercourse. For female, you might have pain with intercourse. You might have pain after intercourse. And then, like I said, there's a whole host of other things. Bladder, urgency, frequency, retention. You might be having irritable bowel syndrome. You might have hip pain. You might have back pain that connects with all of this. And for some of you, for females, you might have pain even inserting a tampon or having a gynecologic exam. And for males, if you end up seeing a urologist and they check your prostate, there's nothing wrong with your prostate, but boy, that exam was really, really painful. So if any of you guys are experiencing this, then the likelihood that you might have this going on is very high. Now, what do you do about this? So what you basically need to do is these muscles that are tight need to be normalized and improved and basically rebalanced, meaning we don't want them to be tight again. For example, if you have tightness in your hamstring, right? What do? You stretch it. So these muscles, it's kind of a similar idea, but it's really hard to stretch these muscles by simply doing a stretch. You actually have to treat a bunch of different things, including these muscles, but you have to actually release a lot of other muscles that actually affect these muscles from the outside. So for many, you're treating everything from back muscles to hip muscles to abdominal muscles to, yes, these muscles directly. And when you improve the balance around this, then you start noticing, hey, my perineal pain is decreasing. My genital pain is decreasing. I'm not having as much discomfort sitting. Perhaps some of you guys are having pain with sitting. Or maybe my bladder is starting to feel better. I don't feel like I have to pee all the time. So what we have developed here at Rebalance, there's a couple of different things. If you live in and around this area, just come in and see us, basically. Because this is what we work on all the time. And it's very easy for us to figure out if this is the problem. However, in this new world that we're living in now, many of you guys cannot travel to come see us, or you have to stay home to keep yourself safe from, all the other things that are kind of out there right now with COVID and flu season and all these other things. So what we have done, we have actually developed a program. It's a 4 to 5 hour program to actually start helping to rebalance this pelvis and to reduce the tension in these muscles, which then reduce the pain that you might be experiencing that you think may have come from an STD, or you've already been told it's not, but you're trying to figure out where is that pain coming from. So what we did is we created this program. This is based on all of our experience of, all the patients that we've treated clinically, as well as currently at this point in time when I'm speaking to you, 200 people have been enrolled in our program, in our pelvic pain program so far, and they're having great results treating this and starting to see progress and improvements. The other thing we also have been doing, which again, all the links are going to be down below in the description box, is we've been actually doing consults, phone consults to help you better understand, for us to get a really good idea as far as what has been happening, really understand your problem, your condition, and then giving you the recommendations, helping you understand what is going on, and giving you the recommendations and referrals that we think that you might need to help this move in the right direction and help get this better in this problem, this pelvic floor problem that can be very, very confusing, depressing, and just making you feel like that this is all you're thinking about. So go down in our description box. Our website is down there. We have lots of other YouTube videos because for many of you, this is one part of what might be going on, but I try to make as many YouTube videos as I can to try and explain many different scenarios of what other people might have going on. So you might be relating to those as well. You can go onto our website, sign up for our blog, subscribe to our channel, because we're constantly putting out new material to help you guys understand the connections of all of these things, pelvic floor being one part of it, but also how is the hip and the back and everything else connected to what might be going on. And again, our program for both females and male is going to be down in the description box, as well as your ability to have a phone consult with us. So I hope for some of you, this video already just reduces your stress and anxiety. Again, stress and anxiety only makes muscle tension worse. So my hope is that you watch this video, you have a little bit of a sigh of relief to say, hey, I think there's somebody out there that actually understands what I'm going through, and that I might actually be able to now fix this problem that I have, or at least get it going in the right direction. So give a shout out to us, leave a comment in the comment box. And we try and answer as many questions as we can, given our limitations as far as what we can write back on YouTube. But again, join us on the other side, and you can join one of our programs that are listed below, because we try and address how to release all this musculature and get you moving in the right direction. So I hope this was helpful. Guys, have a wonderful day. Take care.